My name is Dr. Paul Stanislaw, and I'm going to talk about the most common question that I get throughout the day, which is there a non-surgical way to make my neck look better? The issue is with the neck, there are multiple layers of problems. The first problem is that there's a lot of extra skin that's here. When we're young, our skin is like a rubber band, and when we turn our head, the skin would stretch, and when we come back, it would contract, it would maintain its shape. And as we get older, we lose the elasticity in our skin, so that when we turn our head and we come back, because it's like a stretched out slinky now, it doesn't conform to the shape, it's sort of hanging more. So the skin itself is a little bit bigger, there's more skin there than it was when we were younger. The next issue is that there's fat that often occurs here. Not in everyone, but in some patients they have fat that just sort of hangs down here underneath of the skin, which makes them look like they've got a double chin. Underneath of that are the muscles, and oftentimes as we get older we get two bands that run down the center of our neck, and those bands are from a muscle called platysma muscle, which is a thin sheet of a muscle, and it's a thin sheet on one side and a thin sheet on the other side. And we're young, it's tucked up high underneath of our chin, and as we age, like everything else, it starts to sag down, and when it sags down, you're seeing the edges of the muscle on end, and that's what gives us the bands here. Because there's three different components there, you need a treatment that addresses all three components. Currently, there are many non-surgical ways to try to tighten up the skin. The issue is that the skin of the neck is very sensitive. It doesn't handle laser treatments very well. It can't be can't have a strong chemical peel. So you can only do very mild things to the neck skin. And the problem is that when we do very mild things, you can't achieve that much of a goal. So I see a lot of patients who come in who have spend a lot of money on laser treatments, radiofrequency treatments, and ultrasound treatments to try to tighten that skin up, and they come in and tell me that their skin looks exactly the same, the neck looks exactly the same. The only way really for me to make that skin better, since I can't make it elastic again, is to actually remove some of that extra skin. Now, there are sometimes, but it's rare, where people make the incision underneath of the chin and they cut out that skin, but that leaves you a scar that's right in the front of the neck, which is tough to hide sometimes. So essentially, to fix the neck, we need to do a facelift neck lift, and that's when we make incisions around the sideburn and around the ear, and we take all of this tissue and we lift it up and we redistribute it back in a more youthful position, and then we trim out that extra skin around the ear so that the incisions hide beautifully around the ear and around the hairline. So that's what addresses the skin. Now, for the neck, for the fat that's underneath of the chin, there is an injection now for trying to dissolve the fat that's here. The issue is that if you dissolve the fat here without addressing the bands of the neck or the skin, what happens is this is like a deflated balloon. It gets all wrinkly, and you'll notice that all the pictures that people show for that type of treatment, they're looking at it from the side view, and there's no images on the front view, because the images would show that there's all sorts of wrinkles on the front. So again, if you just address the fat, because our skin doesn't have the elasticity to contract anymore, it'll just be like a deflated balloon. And then lastly, we have the muscles that are there. There is no non-surgical treatment to lift those muscles back up and to reposition to a more youthful position. Unfortunately, it's only surgery, and that's, again, what we do is we make the incision around the ear, we're taking the back side of that muscle and we're lifting that muscle and we're repositioning to a more youthful position. So the only way to address all three components of the neck is really a facelift or neck lift. The question is what is a facelift? And there's many different terms for a facelift, and what I'm describing is, when I describe a facelift, it includes a neck lift. So when I make an incision around the ear, also addressing the jowls and the marionette lines, and as I lift this up, not only does it help the neck, but it helps the jawline and